Welcome to Connective Care Education Learning Workshop Unit 004 Health and Wellbeing Children and Young People. This learning workshop will cover Outcome 8, Administration of Medication, and Outcome 9, Personal Care. Legislation and national guidance related to the administration of medication. Legislation and national guidance related to the administration of medication includes Social Services and Wellbeing Act, Wales, 2014. Misuse of Drugs Act, 1971. Regulations 1972 and 2001. Health Act, 2006. Controlled Medication. Control of Substances Hazardous to Health, COSH, 1999. Hazardous Waste Regulations, 2005. Mental Health Act, 2007. Mental Capacity Act, 2005 and Associated Code of Practice. All Wales Guidance for Health Boards, Trusts, in respect of medicines and healthcare support workers, November 2015. Care Inspector at Wales National Minimum Standards Daycare. In childcare settings, the national minimum standards for regulated daycare give guidance in Standard 11. The registered person is responsible for ensuring that 11.1. If medication is administered to a child, this is with the written agreement of the parent and with an understanding of the possible side effects of the medication. If medication is self-administered by the child, this is in line with written guidance from the parent and with an understanding of the possible side effects of this medication. 11.2. The parent gives written permission before any medication is given. 11.3. Medication is stored in the original container, clearly labelled with the child's name, and must be inaccessible to children. 11.4. Written records are kept of all medicines administered to children, and parents sign the record book to acknowledge the entry. 11.5. There is a clear policy, understood and implemented by all staff and discussed with parents, about the storage and administration of medication. The policy conforms to the terms of the registered person's insurance cover. 11.6. Prescription medicines are not administered unless a doctor has prescribed them for that child. Any medicine received into the setting is not out of date. 11.7. Information is gained to establish from the person delivering the child exactly when medication was last administered, and 11.8. If the administration of prescription medicines requires technical or medical knowledge, then individual training is provided by a qualified health professional. Training is specific to the individual child concerned. Please stop the video here and open Worksheet 1. Once you have completed Worksheet 1, please continue with the video. Roles and responsibilities of those involved in prescribing, dispensing, and supporting the use of medication. Policies and procedures in settings related to medication are put in place to ensure that legislation is being followed so that both practitioners and those being cared for are safe. Policies will outline the roles of different individuals in the administration of medication within organizations. It is the role of the doctor to prescribe medication, indicating the dose, type, and amount of medication to be given. The doctor should explain what the medication is for and any side effects. It is the chemist's or pharmacist's role to dispense the medication, checking that medication dispensed matches the prescription. The medication should be labeled with details such as the name of the individual who is to take the medication, the name of the medication, the date it is supplied, and an expiry date. The dose to be taken, how it is to be taken, for example orally or intravenously, and how often. Any special instructions, for example, eat before or after food, should be recorded. In the case of over-the-counter medicines, the pharmacist has a responsibility to make sure the medicine is suitable for the individual and the medical condition they want it for. In a social care setting, the manager should ensure that policies and procedures are in place that meet regulatory requirements and that staff have regularly updated training on the administration of medication. They should ensure that care plans and record-keeping systems are in place. Regulation 13 of the Health and Social Care Act 2018, Regulated Activities. Regulations 2010 state that the registered person must protect service users against the risks associated with the unsafe use and management of medicines by means of making of appropriate arrangements for the obtaining, recording, handling, using, safekeeping, dispensing, safe administration, and disposal of medicines used for the purpose of the regulated activity. In the case of over-the-counter medicines, the manager has a responsibility to confirm with the resident's general practitioner that any over-the-counter medicines will not interact with prescribed medication. It is the carer's role to ensure that the patient gets their medication. They need to ensure that they give the correct medication at the correct time and the correct dose. The respect and dignity of the individual should be maintained during the administration of medication. Records of administration of medication with date, time, and dose should be kept. Carers should be aware that over-the-counter medicines shouldn't be taken with prescribed medicines unless a doctor or pharmacist has confirmed that it is safe. Please stop the video here and open Worksheet 2. Once you have completed Worksheet 2, continue with the video. Links between misadministration of medication and safeguarding. Errors and malpractice occur in the administration of medication through procedures not being followed correctly. Some may be intentional, where staff may misappropriate drugs or use sedatives to manage behavior. Mistakes can be made at each stage of the medication process by the general practitioner, pharmacist, manager, or carer. The misadministration of medication is considered to be a safeguarding issue when there are concerns that there has been medication withheld without a valid reason, incorrect use of medication other than for the benefit of the patient, child, or young person, deliberate act of harm using medication, accidental harm caused by an administration of medication error, deliberate falsification of records relating to the administration of medication, misuse or over-reliance on sedatives to control behavior. Staff in social care settings, including childcare, should be aware that concerns regarding the administration of medication should be reported under safeguarding procedures. The importance of supporting personal care routines for children and young people. Personal care routines will include personal hygiene, bathing, cleaning teeth, and menstruation. Personal care routines for children are important as their young age means they are not able to carry out these routines for themselves. For example, young children will need support with toileting, toothbrushing, hand washing, and dressing. Through these routines, they will gain more independence and learn skills required for day-to-day life and personal care. Personal care routines support good health and hygiene. Communication during care routines with young children helps build communication skills and positive relationships. As children gain skills, they gain confidence and develop a positive self-esteem. Fine motor skills are developed during many routines, such as dressing. Care routines help babies and toddlers adapt to a pattern of daily routines and become familiar with daily hygiene procedures. They help them deal better with transitions and new experiences as they are familiar with the expected routines and procedures. As children grow, they may have additional personal care routines. For example, routines during menstruation are important to support good hygiene, health, and dignity. Please stop the video here and open Worksheet 3. Once you have completed Worksheet 3, continue with the video. Ways to treat children and young people with dignity and respect when supporting them with their personal care routines, taking into account their background, culture, and religion. Personal care routines for children and young people include personal hygiene, bathing, cleaning teeth, and menstruation. Personal care covers areas of physical and medical care that most people carry out for themselves, but that some children and young people may need assistance to do because of medical need or disability. Help may be needed with areas such as eating, drinking, dressing, washing, and toileting. All children have a right to be treated with dignity and respect. They should also be talked to politely and courteously during personal care routines. Time should be taken during personal care routines to promote children and young people's personal development and encourage their independence in personal care routines. Children and young people who feel in control of their bodies and personal care routines are less vulnerable to abuse. Religious and cultural beliefs should always be taken into account when supporting personal care routines, and carers should always find out about each individual child's background. Ways to treat children and young people with dignity and respect. Talk to the child or young person by name and get to know them before any routine starts. Respect and understand any religious or cultural preferences. Explain procedures in a language and using vocabulary the child or young person understands. Respect any personal preferences of the child or young person. Encourage independence. Involve the child or young person in decisions. Request permission to touch or undress. Ensure privacy and modesty. Religious and cultural considerations include African Caribbean community. Use pick-style combs, cocoa butter, or coal tar shampoo are also used. Buddhists prefer showers to baths. Chinese people prefer showers to baths. Hindus like running water in the same room as the toilet. Showers are preferable to baths. Muslims require a high standard of cleanliness. Sikhs prefer to wash in running water and a shower is preferable to a bath. There should be water in the same room as the toilet. Please stop the video here and open worksheet 4. Once you have completed worksheet 4, continue with the video. Ways to support children and young people with their personal care routines in a way that protects both the child or young person and the adult supporting them. During personal care routines, it is important to protect both the child or young person and carer. This can be done in a number of ways. Wearing personal protective clothing, using safe, age-appropriate equipment and materials, safe disposal of waste and soil materials, ensuring changing areas are visible, carers being visible and not alone with the children, recording and reporting any concerns, marks or bruises, no mobile telephones or electronic devices in changing areas, following policies and procedures of the setting. Please stop the video here. You have now completed the learning aims of Unit 004, Outcomes 8 and 9. You may now close the video.